All right, today we're going to tackle a topic that affects millions of people, but here's the kicker, it's also one of the most preventable kinds of cancer out there. We're talking about cervical cancer, and really understanding it is the absolute first step toward taking control.
So let's just start with this one powerful question. What if a cancer that's pretty common could be, for the most part, stopped in its tracks? I mean, really think about that. That's the core idea we're digging into today. Because when it comes to cervical cancer, knowledge isn't just power, it's everything.
Okay, so first things first, what exactly is cervical cancer? Let's break down the basics so we're all on the same page.
In the simplest terms, cervical cancer is all about its location. It's a cancer that starts in the cells of the cervix. And if you're trying to picture it, the cervix is that lower, narrow part of the uterus that connects down to the vagina. That's our starting point right there.
And you should know it's not just one single thing, but, and this is a big but, the vast majority of cases, we're talking a whopping 90%, are something called squamous cell carcinomas. These start in the flat cells on the outer part of the cervix. The other types are way less common.
So now that we've got a handle on what it is, the next big question is why? Why does this happen? Getting to the root cause is absolutely the key to prevention, and for cervical cancer, the main culprit is actually really specific.
Okay, this right here, this is probably the single most important sentence in this entire explainer. Almost all cervical cancer is caused by a persistent, long-lasting infection with HPV. That's the human papillomavirus. And this isn't some rare, exotic thing. It's an incredibly common virus, usually passed during sex.
So how does a super common virus end up causing cancer? Well, I love this analogy. Think of it like a slow, undetected leak in your house. Most of the time, your body's immune system just clears an HPV infection, no problem. But every once in a while, it sticks around. And that long-term infection is the slow leak that, over many years, can cause healthy cells to change and become cancerous.
Now, I know that might sound a little scary, but hold on. Take a look at this number. Even though HPV is super common, only about 10% of people who get it will develop that persistent long-term infection that actually puts them at risk. So the key takeaway isn't the virus itself, it's the long-lasting infection that we really need to worry about.
And you know, certain things can definitely up the risk of an infection sticking around and becoming dangerous. Take smoking, for example. It doesn't just hurt your lungs, it can actually damage the DNA in your cervical cells and make it harder for your immune system to fight off HPV. That, and these other factors, just make it tougher for your body to do its job, which in turn raises the risk.
Okay, so if this is a slow leak, how would you even know it's happening? This next part is absolutely crucial, because the signs, well, they aren't always obvious. And this right here is the really tricky part. In its earliest stages, when it's most treatable, cervical cancer is often totally silent, no symptoms at all. The more serious signs, like leg swelling or a constant backache, they usually don't show up until the cancer is much more advanced. And that is exactly why getting checked proactively is so important. Which, of course, leads to the big question, right? If you can't feel it, if there are no symptoms, how on earth is anyone supposed to find it?
Well, the good news is, there's a very clear path. If a screening test comes back with anything abnormal, a doctor will often do what's called a colposcopy, which is really just a fancy way of saying they use a special magnifying tool to get a much closer look at the cervix. If they see any spots that look unusual, they'll take a tiny sample of tissue, that's a biopsy, to test it for cancer cells.
So once a diagnosis is confirmed, what's next? Well, that's when we get into a process called staging. It's all about figuring out the best way to move forward.
Staging is basically just a way to figure out how far the cancer has spread. So stage 1 means it's still just in the cervix, but by stage 4, it means the cancer has spread to other parts of the body. Figuring out the stage is the single most important factor for deciding on a treatment plan.
And based on that stage, doctors have this whole toolkit of options. Depending on the person's health and preferences, the plan might involve surgery, radiation, chemo, or even newer approaches like immunotherapy to fight the cancer.
Okay, now for what I think is the most important and honestly the most hopeful part of this whole conversation. We've talked about what causes it and how to treat it, but the real goal here is to stop it from ever happening at all.
And if you need any convincing about why this matters, just look at this chart. The difference is, wow, it's night and day. The 5-year survival rate for cervical cancer that's found early is an incredible 92%. But if it's found late, that number drops off a cliff, down to just 17%. The stakes just could not be higher. So the mission becomes crystal clear, right? We want to stay in that 92% world. The crucial question is, how do we make sure we catch it early? Or even better, prevent it from ever getting a foothold?
And thankfully, we have a super effective 3-part game plan for this. First, the HPV vaccine can stop the root cause, that HPV infection, before it even starts. Second, regular screening tests can find those abnormal cells that slow leak long before they become cancer. And third, practicing safer sex just helps reduce your overall exposure to HPV.
And when it comes to that screening piece, the guidelines are pretty straightforward. Here's a clear, actionable takeaway. Doctors generally recommend getting a Pap test every 3 years, or if you get an HPV test along with it, you can stretch that to every 5 years. It's about staying ahead of any potential problems.
So we started all of this with a question, and that's how we're going to end it. We've seen that cervical cancer is almost entirely preventable and highly treatable when you catch it early. So knowing that so much of this power is literally in your hands, what's your next step?